Hi, my name is Dr. Brendan O'Shea. I'm the Director of the PRC at the Irish College of General Practitioners, and I'm delighted to be at EQUIP in Dublin to reflect on patient safety. Our presentation was delivered by myself and also my faculty colleague, Dr. Mary Carney. We were here to discuss an initiative that we developed in Kildare. You can find out about it yourself by looking at the website. It's www.bettercareinkildare.com, www.bettercareinkildare.com. Essentially, it was a regional-based initiative around care of the complex comorbid patient. The story behind it was that in 2014 in Kildare we were exercised by the constraints that we were operating under for providing care to individuals with complex comorbidities. We really felt we needed to do more and that we could do more. So the story went on. We had a series of faculty meetings. One of them focused around brief interventions. One of them focused around the practice and theory of better chronic disease management. One of them related to end-of-life planning, because end-of-life planning really should be an integral part of chronic disease management. And a fourth meeting focused around the business case, getting the practice ready in order to embark on improvement. The next thing we did was we set up an expert group, and this was a regional initiative, so we were delighted to involve 3 general practitioners from the faculty with 3 specialists from Naas Hospital, who together very quickly agreed a set of guidelines around the key 5 conditions that we identified. The 5 conditions that we identified included hypertension, COPD, diabetes, schizophrenia, and cardiovascular disease. Once we had agreed the guidelines, we reflected back to the faculty on the guidelines. An important part of this was we agreed ICPC codes, and this was a very unifying factor in the initiative. Once we had launched the guidelines, 7 practices in Kildare went for the project as a practice-based exercise. And Dr. Mary Carney's presentation then related to how she found this approach worked in her practice for the purposes of her annual audit. We had 2 pieces of data really to present. One of them related to the increase in coding for the 5 conditions across the 7 practices. We sampled the practices in 2015 and we had 2,200 patients in the 5 practices coded for 1 or more of the 5 conditions. After a year we had increased this to 2,900, which was a significant. So what we have is we have a cohort of patients with these 5 conditions in the 7 practices with electronic medical records, and this is a good foundation to go on and do additional work with. Dr. Mary Carney's work, on the other hand, looked at how the guideline worked in her specific practice. And likewise, she demonstrated very significant improvements across a range of desirable parameters, whether blood tests were being done, whether BMI was being measured, whether brief interventions had been given in relation to alcohol, in relation to exercise, in relation to weight. At the end of 2 years, we feel that we've got a useful model. We'd be very keen to find out what you think about it. So please log on to the website and follow it up if it's of interest. If you have any comments, you can put them into the Twitter space. This is a fantastic conference. It's very clear that a lot of the delegates coming from all over Europe clearly have been doing work in a practical way that reduces risk and harm to patients. It's a really worthwhile exercise. Thank you for listening.